Before using Zolocard implant, make sure to read the patient information leaflet provided by your pharmacist. This medication is an implant that releases hormone into your body slowly. It will be placed under the skin of the lower abdomen by a healthcare professional. The implant is absorbed into the body over several weeks or months. Your doctor will instruct you on how to receive this medication. The 3.6 mg syringe is usually injected every 4 weeks, while the 10.8 mg syringe is usually injected every 12 to 13 weeks. Be sure to follow the dosing schedule carefully to get the most benefit from it. To help you remember, mark your calendar to keep track of when to receive the next dose. Do not stop this medication without your doctor's approval. The dosage will depend on your medical condition and response to treatment. It's normal for hormone levels to increase before they decrease during the first few weeks of treatment. This may cause new or worsening symptoms, such as increased pain or difficulty urinating in men. If you experience these symptoms, contact your doctor immediately. In women, menstrual periods should stop when using this medication regularly. If regular periods continue after 2 months of treatment, inform your doctor right away. Usually, the implant will be slowly and completely absorbed by your body and will not need to be removed. However, if you experience serious side effects or other problems, your doctor may remove the implant. If your condition worsens, be sure to inform your doctor. Some common side effects of Zolocard implant include hot flashes, dizziness, headache, increased sweating, decreased sexual interest/ability, trouble sleeping, nausea, change in breast size, vaginal dryness, or hair loss. Pain, bruising, bleeding, redness, or swelling at the injection site may also occur. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, such as vaginal burning/pain, pain during sex, in women, breast pain/tenderness, new/worsening bone pain, new broken bone, burning feeling in feet/toes, swelling of the ankles/feet, unusual tiredness, signs of kidney problems, stomach/abdominal pain or swelling, or mental/mood changes. This medication may rarely make your blood sugar rise, which can cause or worsen diabetes. Tell your doctor right away if you have symptoms of high blood sugar such as increased thirst/urination. If you already have diabetes, check your blood sugar regularly as directed and share the results with your doctor. In men using this medication for prostate cancer, a rare but very serious urinary blockage problem or spinal cord problem, compression, can occur, especially during the first month of treatment. Tell your doctor right away if you have any of the following serious side effects: severe back pain, numbness/tingling/weakness of the arms/legs, inability to move, painful/difficult urination, or blood in the urine. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. And remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed here. Before using Goserelin, it is important to tell your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions. It is also important to discuss your medical history, especially if you have a history of certain conditions such as abnormal vaginal bleeding, diabetes, heart disease, or mental/mood problems. If you have diabetes, this medication may affect your blood sugar levels, so it's important to monitor your blood sugar regularly and discuss the results with your doctor. Goserelin may also affect heart rhythm, QT prolongation, especially if you have certain medical conditions or are taking other drugs that may cause QT prolongation. Low levels of potassium or magnesium in the blood may also increase the risk of QT prolongation, so it's important to talk to your doctor about using Goserelin safely. Older adults may be more sensitive to the side effects of this medication, especially QT prolongation. If you are pregnant or plan to become pregnant, it is important to discuss this with your doctor. You should not become pregnant while using Goserelin, and reliable non-hormonal forms of birth control should be used. It is not recommended to breastfeed while using this medication, as it is unknown if the medication passes into breast milk. When using Zolocard implant, it's important to be aware of potential drug interactions. These interactions could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If the implant is accidentally swallowed, it can be harmful. If the person who swallowed it is experiencing severe symptoms like passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Make sure to follow up with your doctor for any necessary lab tests while you're using Zolocard implant. These tests may include checking your blood sugar levels and hormone levels. It's important to keep all of your medical and lab appointments to monitor your progress and make any necessary adjustments to your treatment plan. If you have any questions or concerns, be sure to consult your doctor for more details. Make sure to take each dose of the Zolocard implant as directed by your doctor. If you happen to miss a dose, be sure to consult your doctor or pharmacist immediately to get a new dosing schedule. It's important to note that missing a dose may lead to sudden or unusual vaginal bleeding, also known as breakthrough bleeding. So, it's crucial to stay on track with your dosing schedule to avoid any potential complications. When it comes to storing your Zolocard implant, it's important to follow the specific instructions provided by the manufacturer. Make sure to keep it out of reach of children and pets. And when it comes to disposing of the product, it's crucial to do so properly by consulting with your pharmacist or local waste disposal company. Never flush it down the toilet or pour it into a drain unless instructed to do so. And always discard the product and it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.